you miss, you hear the sound.
Hello, and welcome to Better Together, sharing our lupus stories. I'm Chanel Gabriel, and we are all the way live and talking about lupus. Please meet my amazing co-host, the wonderful Dr. Michaela Baird, joining us on this stage. Hi, Dr. Mika.
Hi, Chanel. So great to be back with you this week. We have some good things in store tonight. We'll be talking about a sometimes controversial topic, but always a very important one, and that is clinical trials. And we're going to be talking specifically about why diversity matters in clinical trials.
Yes, and we want to hear from you. Okay, please send us a comment, a question in the chat. We will be happy to bring you into this lovely conversation. And okay, tonight, clinical trials. Dr. Michaela, no two words trigger Black people more than clinical trials, okay?
So true.
Especially post-pandemic or, well, mid-pandemic, or thinking about that. Black people in general, this is very sensitive subject for us. And Black people have been historically very much underrepresented in the clinical trial participation here in the United States. And we know that research and medical professionals are looking for solutions to the problem. So what are your thoughts around that?
I mean, I can't stress enough how important it is for us to participate because the roles clinical trials play in helping us assess the effectiveness and safety of these drugs we're really trying to bring out and make available. And so, if we're not represented, we don't really have as much information as we need to know exactly how the drugs will impact us, and we need to know for sure that they are being developed and equally as effective and safe for us when we're talking about communities like the Black community.
Well, I mean, let's keep it real. One of the reasons we don't like clinical trials is because of the lack of trust in the medical system and the clinical trial process, and for good reason. I mean, just to bring some history in here, in 1932, the US government began experiments in, I think this is one of the more prevalently known ones, in the Tuskegee, Alabama experiments. For the next 40 years after that, 400 men with syphilis were not treated to penicillin, but they were studied to see the effects of syphilis, what would happen if they were left untreated. Now, none of the men are aware of this. And this controversy covered 65 years. Okay, and let's keep talking about this. In addition to what happened in Tuskegee, there is the Henrietta Lacks story, where her cells were used without her permission for medical research. Why would we not be surprised? Why is there a surprise that the distrust is so deep rooted in the psyche of Black people? As a result, generations of people, and mostly Black Americans, they now harbor a deep-seated fear and distrust of medical testing, especially if it's government sanctioned. I mean, and can we blame them, right? But now the history is even part of our popular culture. I don't know if you got to see the movie, They Cloned Tyrone, that's on
Mhm.
Netflix. I definitely thought about that and how it relates to this. But in the movie, it takes like a humorous sci-fi twist on experimentation on Black folk. And the movie is entertainment, but it definitely strikes a chord in this conversation. So
Right.
now, what does it all mean? The overall impact has meant that medical advancements for Black people in particular can't help but be slow, right? And for those of us who have lupus, which is already a mystery, trying to find answers to our illness, it's been very slow as well, maybe even non-existent.
It's true, Chanel. I mean, you can look back and see that in the 1900s, many protections for people volunteering for clinical trials did not exist. So, if you're interested in learning more about this and the history and events that have really shaped what clinical trials look like today, and now the protections that have put in place, you can actually check out our Biogen trial link, which is biogentriallink.com, and go to the patient's rights timeline because there has been an evolution in this, and it's really great to see those changes. But Chanel, we all know you are really a face for this issue, and you've been so active in this cause. You've participated in trials. We've talked and you've shared your experience in many ways. you know, so I want to hear more about, your experience. I'm asking from everyone for you to tell us a little bit about what are clinical trials, what do they mean to you, and do you do them? I guess I kind of answered that already, but maybe you can share your own perspective.
Well, as you see, I was on the cover of USA Today in a segment that was about this whole conversation around clinical trials. So yeah, I do speak a lot about living with lupus and that struggle that happens when you can't find medication that really works for you, or that's really you're seeing success with. And so I do them. I believe in them for multiple reasons. And I've heard all of the stories and situations, and I still thought it was valuable. I had to really educate myself about what the clinical trial process was. But to be clear, my first response was no. When I first got asked, I said no. I was like, no. And I thought about those stories that we mentioned, and I thought about those things. But I also recognize that, there are a lot of things put in place. And those are the things that I think made me feel a lot more trusting. I think one of the big things is the fact that, if at any point in time, if it's not working for you, or if your health declines, you can leave the study. And I thought that you just signed your life away and forever were beholden to the scientific world. So, but I'm curious. Do you present this to your patients, and what are those conversations like?
Yeah, I mean, I think it comes up all the time. We talk about what it means to be in a clinical trial. And I think tonight we're really going to talk about that specifically. Like, what does it really mean to sign up? Who are the people on the other end? But I think that it's important we know the history so we can understand what have been the barriers in the past. I mean, throwing this back at you, you talked and just shared with us some of the history. What has helped you overcome that and said, okay, I know that, but I'm still going to participate?
For me, it was more knowing that my medical doctor was still following up with me, and that at any point in time, she would be able to step in,
Mm-hmm.
and also I recognize that the only way that these things come out is if people like me try them, and people like me do this, and that there's a whole process that I'm sure we're going to talk about with our guests, but there's a whole process that goes into anything even getting to human trials. So, and I think we're gonna get started about that. Like tonight, what are we going to talk about? This whole process of clinical trials, and yeah, we're gonna get into the nitty gritty about it. So right now, I think if we don't talk about what's really going on with Black people and testing and clinical trials, we are not going to be able to move this needle forward at all. See what I did there? Move the needle. So today we're gonna be meeting some great people. We're gonna meet Dr. Pamela Payne Foster. Dr. Foster is a professor at the University of Alabama and supervises the Deep South Health Equity Project. Now, the project's goal is to increase the participation of lupus patients in clinical trials. She has also served on the faculties of Morehouse School of Medicine,
Wow.
George Washington University, and Tuskegee University, which is historically interesting because we've been talking a lot about Tuskegee. But we're also going to talk to her about the lupus study and about Tuskegee.
Great.
And great. Wait, and we got some lupus warriors in the building. Got to shout them out too. We have Evelyn Pelt and Chelsea Walker. They are here to give their personal testimonials. Evelyn Pelt is a development specialist for the state of Alabama. This year, she participated in Dr. Foster's Deep South Health Equity Project. I believe was a peer leader there. Evelyn is also the facilitator for the Tuscaloosa Lupus Support Group, founded by Dr. Foster. And we have Chelsea Walker, a student nurse and a miraculous survivor of not one, not two, but 3 comas. We are so happy to have you here. Chelsea participated in a clinical trial after continued difficulties managing her lupus. She says that the drug trial changed her life, and she still uses the drug today. Chelsea is also the brand ambassador for the beauty care line, Glow, and it's spelled very special, Gleaux, excuse me, by Deja, Glow by Deja. And last but not least, we have our expert. She left big business to blaze her own path. In 2019, Bridget Chapital left her director level job at a leading clinical research company to make a deeper, more personal impact in the industry. Bridget, now known as the Clinical Trials Lady, is the founder of Hypothesis Haven Science Club, the first and only medical science program for children ages 6 through 12 that uses the clinical trial process to teach kids about science. Bridget is a contributor to our friends over at blackdoctor.org, and she's the brand ambassador for the Black Women in Clinical Research. They are holding their convention in October. Make sure you check it out. But we have amazing people in here. So we're going to talk to our first guest, Meet University of Alabama professor, Dr. Pamela Payne Foster. Dr. Foster supervises the Deep South Health Equity Lupus Project, or DS Help. I'm a good friend with those folk over there. They're a research study. DS Help is a research study about lupus patients and clinical trials. And we're going to talk about that program in a bit. But welcome to the stage, Dr. Foster, Dr. Pamela Foster. Thank you.
Hello, nice to be here.
Hi, thank you so much for coming and for sharing your work. And so great to see you again. We did a whole
Yes, so good to see you as well.
a couple months ago, right?
Right.
But we're going to start with the ground zero of this conversation, the Tuskegee experiment. So now,
Right. And we like to call it the U.S. Public Health Service
is that what it is?
syphilis experiment. We're trying to get away from the name
Understandable.
Tuskegee, not their fault. It was put on by the U.S. Public Health Service. So, and names are so important, right, Chanel?
No, thank you. Thank you so much for bringing that up. And that's something that I can imagine. And I didn't think about it until you said it, how that actually impacts.
The impact on the town of Tuskegee, the university, even though they played a role in it, but they weren't the major culprit, was the U.S. Public Health Service. So we like to use that name. And our project, DS Help, was really one to increase awareness about the importance of clinical trials, Blacks being in clinical trials for lupus, not only for the patients, but also primary care providers, and also increasing the number of researchers who do research in this area. I mean, a lot of this is about education. Chanel, I love how you started out with some historical context. But the real reality is, in history, there's some, even if there are bad events, some good comes out of it. And two things that came out of the experiment were informed consent. We didn't have that before in 72 when the experiment came out, and also IRBs, Institutional Review Boards. So there is much more accountability for doing research, especially using human subjects and vulnerable. You know, that population at the time was very vulnerable, being from the Deep South, poor men and their families, because of course that syphilis affected their families as well. So although horrendous history, even with the Henrietta Lacks story, NIH is now talking to the family and engaging them in the process of research, which is a good thing. So,
Dr. Pam, you've been mentioning so many important things about how, being at Tuskegee, you separated, a little bit of that story from the institution, the university.
Right.
You've mentioned some really important things that I don't think everyone knows about or knows what they are, and that's informed consent.
Correct.
And IRBs. Could you talk to our viewers a little more about what that means?
Yeah, so I love what Chanel said about the biggest thing about clinical trials, and somebody even stopped me from saying clinical trials, just say studies, because that word is so loaded, is that it's voluntary. So that's because with informed consent now, whenever you do any kind of procedure, surgery, clinical trials, whatever, you have to know what the risks and benefits are. You have to know what it's about. Those men in the syphilis study had no idea that they were part of a study.
Right.
They had no idea. They didn't even know that it was about syphilis. They called it bad blood. So you have to know what the risks and benefits are. You have to be very, very well informed before you can even do the study. And it's voluntary. If at any time you want to leave the study, you can. It's totally voluntary. So I think that's important. And the institutional review boards are ways to have really objective oversight over studies. A lot of times with researchers, our aims are not pure. they're self-motivated, because the study in history was only supposed to go on for a year. It ended up going on for 40 years. It's really the longest non-clinical trial in U.S. history, non-therapeutic clinical trial in U.S. history. Remember, they didn't give the subjects anything; they just watched them, and so that's just so important to know.
So what made you decide? Thank you for that information, because
Sure.
getting a form and knowing that like people have to be educated on the risks and benefits, being on a trial.
Yes.
That's absolutely important, and just being able to have informed consent. I think that's
Right.
another thing that is important to this process. But I guess just curious, why do you think there's this DS help? Why is it so important for us to have this study on lupus?
Well, for us, a lot of the studies trying to really understand why people are not doing clinical trials are not done in the South, not done in the Deep South, and not done in rural areas. And we know that a lot of the trials are at academic health centers in big cities, where people in rural areas don't have access. So we've got to think of other ways to decrease those barriers. One might be telehealth. For those, the distance for most in our state have to go to Birmingham is a big academic health center. So other ways to think about where we conduct clinical trials, they're all in big cities, usually in large academic health centers where rheumatologists, I know Dr. McCullough is a rheumatologist, but maybe thinking about training primary care doctors to do some of these clinical trials as well in their own settings where their patients are would be helpful. The other thing I wanted to mention about institutional review boards, they're usually at big medical centers, same thing, academic health centers. But there's a push to have community IRBs, institutional review boards, so communities can begin to vet who comes into their communities to do research. And so having patients be at the forefront of saying who comes in our community and does research is important, and having that IRB, community IRB, is another movement that we're seeing.
I mean, what I'm really hearing from you, Dr. Pam, and I love how you're advocating for this, is that we need representation of people who are living with these conditions everywhere.
Yes.
And we need the people evaluating the studies, like
Correct.
on review boards, to represent everyone as well. And I think that's true. Such an important piece.
Yeah, sometimes we have community members. Often they are not ones that have diseases. They might be, for example, at my institution, we have pastors, we have pastor leaders and others, but real patients would be great. And they can advocate for other patients for certain studies.
No, thank you. And so I know you said that we understand the why. So how do you actually have this program serve the Deep South? Like, what is it?
So as a part of our study, we had our participants do online training. There's a program called Lupus Conversations. So they had to go through the online training to understand really why it's important to be in lupus clinical trials. And then we had a special conference. And Chanel, you were one of our presenters. They were all Blacks, Black presenters, because if we're trying to engage more Black patients and providers and researchers, we want people that look like us to give the message to us. We got great results, Chanel. People felt really empowered by just your story, your voice, your presence. And so we're excited to have had that conference. The other big thing that we added to the conference, we know bioethics is a big, major piece of what we need to do in order to bridge that gap of trust. Tuskegee University has the only Black bioethics center. Their center is the only one really focused on Black patients right here in Alabama, in rural Alabama. So Dr. David Hodge was a part of that conference, really talking to us about Black bioethics and those issues around bioethics, which is really important when we're talking about these issues of clinical trials.
Chanel, I have to hear what you said. Give us a breakdown.
Oh no, I was like, oh no, it was both a performance and a panel around just my diagnosis, what led to me participating in a clinical trial, as well as just the fact that I try my best, trying to give some motivation to those living with lupus, understanding the implications of it. Having a chronic illness changes your life, and people don't always think about that. People just go, okay, take this medication, but how does this really impact? And I tried to speak a little bit about it. I did a lot of what we do here, talking about how to live our lives fabulously with this chronic illness that we got. So it was a really amazing time, and the panels were really, really great for the conference. So definitely.
I love it. So, Dr. Pam, you kind of shared a little bit with us about what your great studies are doing. But can you tell us a little bit about, if you see someone on an individual level, how are you really explaining this to people, and why they should, think about or consider a study like yours? Because, as we mentioned, all this history keeps coming up.
Right, right. Well, but we also need to think about the future. And the future includes not only our horrendous past with some of this history of studies, but I think the biggest example here is even when we were trying to get people to think about getting the COVID vaccine, some of the descendants of the syphilis study came out with their own advertisement saying, although they were hurt through this history, the future is so important for us to be involved in studies, in vaccines, even vaccine studies, in getting vaccines, in prevention, and in science. So I think their message said it all. Some of the descendants of syphilis study are still alive and still advocating for the future. And so I think that's so important for us to really understand that without these interventions, we cannot move forward if as effectively as we could.
Thanks. And I mean, I have a question for both of you. We have two doctors here. So, what does it mean for a study, for a trial or a drug to have no or little a small number of Black participants? Like, what does it do to the trial? How does it impact Black people, especially Black people living with lupus?
I think Dr. Michaela said it so well. We don't know how it works. We don't know how drugs work if we don't have the right persons. I mean, the biggest example now is for many years, we didn't know the effects of cardiovascular disease in women because most of the longitudinal studies were done in white men. And so when you don't have that population in there, you get missed. You're missing an important question. So the answer is not there because you're not a part of the question. So I think that's probably the biggest thing. If you're eliminated from the population of the drugs and the interventions that we're trying to test, then you get left out. We don't know how it works in that population.
Yeah, and I think for me on a day-to-day basis, when people are asking me, because a lot of people are great advocates and want to see the studies, and you can look on the pages and see the numbers of people that they relate to. So knowing that there are more and more people who you can relate to in a study, I think changes your consideration if you decide to take a medication.
Right.
I think that that's helpful, just knowing that there's these opportunities. That's so important. Just the idea of like, what does it mean for me to be someone a part of this drug coming to market? This thing, that's there. There's a reason there's a trial because it's usually filling in something. So those are two amazing points. But I'm so excited to have you on here. We're gonna go to our two lupus advocates. We're gonna bring them into this conversation. They have actually participated in the clinical trial process. We have Evelyn and Chelsea. So now we're gonna welcome development specialist Evelyn Pelt and student nurse Chelsea Walker. Now, Evelyn participated in Dr. Foster's study for lupus patients. And now we have Chelsea Walker, who is a part-time student nurse and a miraculous survivor of 3 comas. I got to stress the fact that You're here for a reason. We are so blessed to have you. And Chelsea participated in the clinical trial after continued difficulties managing her lupus. She says the trial changed her life. Now bringing to the stage Evelyn and Chelsea.
Hi.
Hi, Evelyn. Hi, Chelsea. So glad to have you both.
Yeah, good to be here. Thank you.
Yes, my lupus warriors. Well, Evelyn, we're going to start with you. Now,
Okay.
this year you were a peer leader in Dr. Foster's Deep South Health Equity Lupus Project.
Yes. We had many committee meetings beginning, and then we divided up into like groups. We had four peer leaders from each state: Alabama, Mississippi, Kentucky, and Tennessee. And then we had a coordinator of the peer leaders. And then we were charged to come back with questions to address. We had to also recruit 25 participants from each of the states.
Mhm.
And then we would come back, we made questions, a list of questions, we went over them, we gathered them, and then we brought in the participants and we zoomed in and asked those questions to them and got some of their responses. Yeah.
That looks like a lot of really great support. And Dr. Pam, chime in if there's anything that
Mhm.
comes up for you. But also I just realized this. I said I shouldn't even started with this. We're going to talk about those questions, but I didn't ask this question that we ask every lupus warrior that comes in here. Please briefly tell us your lupus story. Your
Okay. Okay, I was diagnosed in the year 2005. It was also the year my mother was diagnosed with non-Hodgkin's lymphoma. Yeah, so it was like, anyway, but when I got diagnosed, I got up one morning and my hand was so stiff, I couldn't literally touch my thumb. So of course I went to the doctor, and then I got my diagnosis probably within a week. So I kind of tell people all the time that I felt like I'm living in denial lupus, because I felt like, which one do I have to do first? You know, I don't think I could fight for lupus and my mother too, because they had to start chemo treatments with her. So I was able to get on a medication, and I've been on that medication since 2005. And I've also been in remission for the last 10 years. So I'm grateful, because I know a lot of people cannot go to work, they cannot function. They have periods of fatigue. But anyway, after I did go through this period of fatigue too. And that's when I joined the local lupus support group, where Dr. Pam Foster was the president. And I went hoping to be in a group that I could talk to and could relate to with some of the issues that I was having. And then, of course, when the project came up, she asked me would I want to participate. And of course, I was a little eerie because I've never done that. So I said, well, maybe. But then she said, let me give you the information and you consider it. So I did. And then we started the project. And then once we pulled in the participants and started asking the questions, we asked a variety of questions. I did not record them. We had a recorder there. So I don't remember details, but some of the questions, if you don't mind me just going on with that.
Yeah, no, we'd love to know some of the questions.
One was, have you participated in a lupus trial? And of course, a lot have not. I had never participated. And matter of fact, I've been with my rheumatologist, 18 years, and he's never asked me to participate.
Mhm.
So for me, it was an educational experience. And one of the courses, they said, have you participated or would you participate? And one of the ladies was an older lady. She was about 65, I think, to 75. I don't remember the age, but she had participated in like 2 clinical trials. And she said she would do it again. And she would do it again because of her children and her grandchildren. She wanted to do her part for her family. Yeah. And then we had one, I remembered, she was a younger lady, and she said she had started to participate in a clinical trial. And for some reason, they excluded her. They dropped her from the program. And she never got an answer to why. So she wanted to know what avenues, because we thought she had a right to know why she was dropped.
Right.
So we talked about some possible avenues so she could find out why she was dropped from the program. And then I think we even asked her later, would you even, since you were dropped from this one, would you even consider doing another one? And of course, she said that she would still consider doing that. So that was a good thing.
Well, thank you.
Wow, Evelyn, that's so helpful to hear all these other stories. We want to hear what made you start being a part of a clinical trial or study.
Well, like I said, part of it was out of just curiosity, because I've never participated. And of course, after Dr. Pam gave me the information, it wasn't any risk involved for me. It wasn't any medicine. It was all educational. So it would have been really dumb of me to say no, because it
Yeah,
was
so
no
this
benefit or risk.
project was
It
to
was,
increase awareness. Someone
yeah,
asked if there were men. There were some men. I think we had a few men participants, but not many, but a few. And even had men in the support group as well. Yeah,
right.
And we don't get to talk about the men with lupus. There are
that's right.
many out there, and many that aren't diagnosed because we always think of this as just a women's
Right.
disease. So,
Right.
but that's
And we have one male. He's just, I don't know if it's because it's mainly female that he doesn't want to become involved. We run the support group at the university, so he works at the university. It could be some of that. Sometimes people really don't want others to know their business. But I think part of the support group is having people really talk and support each other. That's what it's about. Yeah.
I think that's a really good point, Dr. Pam. Maybe you could talk a little bit more about, because these studies are, confidential, and maybe you can talk a little bit about that piece.
Yeah. With the support group, we're sharing and talking, so that's a little different. But yes, these studies, they should be confidential. Your information is not going to be shared with anyone when you're a part of a study. And it depends on what kind of study it is. If it's blinded, sometimes even the provider doesn't know what drug you're on, or if you're on a placebo, or if you're a control arm. It depends on the type of trial it is. But yes, the confidentiality is very, very important, because people really need that in order to think about participating. One thing Evelyn said that was also interesting is there, a lot of our people have a lot of other comorbidities. And so we may not all be able to really be in a trial, because it's so rigid sometimes, the standards for being in a trial. And that can be very devastating to people. They won't try again, for example. Like Evelyn said, that one person who was turned down might not try again. So we have to think about some of the rigidity of the studies that we have, and consider that people have other comorbidities as well.
Thank you, Evelyn. I mean, I know I see, our other guest, our other lupus warrior is like over there nodding. I can't wait to get to talk to you, Chelsea. We're gonna talk to you in a second. But Evelyn, what was your experience during the study? If you can remember, like, what did it feel like? How was the support around you? Just thinking about like what that experience was like. Some people think you're just like sitting in a lab and people are just prodding you and poking you with things. Like, what is the actual experience like?
Well, my experience wasn't like that, because it was all educational. It was gathering information and gathering that information, passing it on, and hopefully making other people aware of how important it is to participate. So, like I said, I had no risk. I didn't have to weigh any risk involved. It was all educational. It's gathering information, listening to information, and sharing information, and just hopefully relaying that information to people that may want to consider participating. And even with my sister, you could also be a participant in this DS Help if you were a family member of a lupus patient. It took nails and nails to get my sister to participate, because first of all, she thought it involved some type of medicine, and it was, I think it's one of the first things that come to mind often when you talk about clinical trials. So maybe studies will be a better word. But I had to convince her to, it was all educational, and that was an easy process, and that it wasn't that time consuming. And even on top of that, they offered a stipend for the participants. And even with that, it was still hard to pull some people in. Yeah. But I had a good experience. One thing, I guess it was the best experience, because I did not have any changes in medicine or any treatment. It was all educational. So hopefully I learned enough. So if someone asked me now to participate in a clinical trial. I said, oh yeah, I'll consider it, because I know that I would have to weigh the benefits and the risks, any restrictions or anything. And then two, I need to make sure I talk to my doctor and make sure it wouldn't cause me an additional health concerns. And then I would make a decision what was best for me.
Evelyn, this is so helpful to kind of hear people's process. I'm so interested in what you learned that was new, like that you didn't know before you went into the study, and if there was anything you brought back to your rheumatologist.
What was new? I guess just making sure that I had a voice. Sometimes I think we forget that we have a voice in our health. Yeah, and then just because I know the doctors are experts, still, does that work for me now? Or if I had a change in my medicine, it's not working for me, and I need him to understand that, because, I wasn't having this problem before, or you up the dose and it causes some other issues for me. I need somebody that would really listen to me. So I think that one of the biggest things that I think I did bring out, that I have to advocate for my own health.
Yeah.
Tell people all the time I need to take a doctor with me to the doctor. Because sometimes, they talk above your head. I'm not a medical physician, I'm not clinical. I need to know what you're talking about in the terms that I understand, so I can make a decision that affects my health, and it has to be the best one, because I'm going to have to live with it.
Yeah.
That's the biggest thing. I think, just to advocate for your own health and not to feel bad about it. And if it doesn't work, if you're going to the doctor and he's not listening, he's not paying attention, or that medicine's not working, I have a right to leave you and go to another doctor.
Period.
Yeah.
Period. Thank you for bringing that into the space. I mean, you said quite a few points that were really, really important. One, the fact that not all clinical trials are medicine. There's studies that happen. I've done those. I think there was one that was measuring my waist, my waistline. I was like, I don't know what this relates, but they're talking about ratios. There's all these different things that people don't necessarily know. But and I think even talking about like how being a part of this does make you a more informed patient, because you're learning so much as you're doing these processes. It's really helpful. I promise we're going to get to you in a second, Chelsea, but I have one final question. But why is it particularly important for people with lupus to participate in trials, like that specific illness? Dr. Pamela, if you'd like to talk to Pamela.
Well, I mean, definitely we haven't had new medicines in a long time. One of the newest ones just came out, and it was decades. So we need to speed up the process of new meds for sure. I think that's a great one. And we need to know how it affects Black women differently than others. We definitely are disproportionately affected, but we need to know a little bit more specifically about, our subgroups.
Thank you. Dr. Michaela, do you have anything else to add to that? I'm just curious. Our other doctor.
No, I mean, I think that it was a really interesting point that Evelyn said her regular rheumatologist never really talked about clinical trials and those options. And I think that it's sometimes something we should task ourselves with, saying, what are those other options? Do you have any clinical trials you can recommend? And I think that's a really great learning point for our viewers.
Yeah, thank you.
Yeah, that's one of the other things we did in the conference. We brought clinical trials in each state. We highlighted them so that the participants could see where they were. Just wanted to add that in, Chanel.
Oh, no, thank you. That is so important. And I mean, I think it's a really great segue for us to bring. I know you've been patiently waiting, but we're going to bring Chelsea in this conversation, who actually participated in a drug trial. And like myself, so first things first, Chelsea, thank you for being here. Please tell us your lupus story.
It's very, very long, so I'm going to just hit the key points. I had just graduated high school. I would take a steroid in high school like every couple months, so I did not start hurting until after I graduated. After I graduated, I would be hurting. I couldn't get up some days. I didn't know what was wrong. I think I got sick bad, ended up in the first coma, medically induced coma, because my heart was beating so fast, like from pneumonia. some vague pneumonia and my lungs had collapsed. So fast forward, going to my second health scare, I'm like, okay, I gotta do something. I get a good rheumatologist finally because when you don't have insurance, everything is so hard. So I finally get a good rheumatologist. So it was her idea for me to try 2 drugs. But I still was kind of in denial. I had it even though I kept getting sick, kept getting sick. I don't want to take the pills. I don't want to take no medicine. I don't want to. I was so young. I was stupid. Well, not, I was young, uneducated. So from there, we tried injection. It was injection. 2 weeks on the injections, 2 weeks off, went back. In Lafayette, we have like, you can go into a system and you can put like, if I would have had a reaction, I could have scheduled an appointment for the next day. You go do your blood work before, you get everything sent to your phone. You know everything. It's like so transparent. You can go in and put your symptoms. You can, it's very detailed, very detailed. So of the 2 weeks after the first drug, took 2 weeks off, got back. From there, she let me make a decision. Do you think this would be better or this would be better? I started getting better with the appointments, better with the doctor because I started paying attention. We would butt heads because I would play on the phone. As things got better, you keep getting older, you keep getting older. My third coma was only because I want to have kids now. So I went to go and get everything fixed up with that. Because with one of the comas, I had ended up having an ectopic pregnancy. That's what really brought me down. So with lupus, everything it just keep hitting. But ultimately, the last go around, I got blessed with some great doctors, and the blood work, everything keeps flowing, and I'm still on one of the medications from the trial, and the second one only when I have bad flares I take it. But I normally don't have no flares. I go to therapy every day, my online schooling. I really have it improved my whole quality of health. Like overall, it improved it.
Wow, and I think that that's so important. Thank you for sharing that. I mean, you have a story, and I really do appreciate the fact that you are still here and you are living. You always say you living your best lupus life. You going to school, you're doing all these wonderful things, and your doctor suggested the trial to you, and the trial, from my understanding, was a four months and 3 drugs, and so when you talk about the therapy, you mentioned therapy. How important was therapy for you?
Every time, like even right now today, I go to therapy. Like I also have lupus, but I have arthritis, so we know that's a crippling disease. So because I'm so young, I go 3 times a week because I want to take it as long as I can. Let's just prolong it for as long as we can. So that's an ongoing thing, the therapy for me. But every time it works.
Chelsea, thank you for sharing so much of your story. And I know you condensed a lot into a short amount of time, but I'm so interested in hearing more about how your doctor talked to you about clinical trials and kind of if you remember anything about that conversation and things that were helpful.
The reason why it came about is like Miss Evelyn Pelt. I was really in denial about the lupus. So I wouldn't take the medicine, I wouldn't. So she came at me with her approach like, okay, we have to do something to make you feel better. She had to go through my mom, make my mom talk to me to convince me, okay, we have to try this. We have to do something to make her feel better. And I would tell my mama, she just don't like me. But it was because I would play with the phone. I was so young and unattentive. I don't do that no more. I pay attention when me and my roomie is running it. Me and he is my dog. That's my boy. Like, but her with the trial, that's what put me onto the medication. And I brought it back to him because like my second go round in the coma, I ended up with some great doctors and I got referrals to all of them. So I kept them. But that one specific doctor, we had a rocky road, boy, me and her, but she would be so direct and so firm. She went through my mom. And once my mom was like, okay, you gotta, and more so, a lot of my cousins also have lupus, and I'm who they call. So I was like, if I could do this and get better for all of us, well, so they always call me and be like, well, cuz, what do you take for such and such? And, well, this is good for pain. I don't take pills. So, this is an injection. Try to ask them if you can. So, yeah, my approach to you is, just try it. It won't hurt.
But
But
it
I
sounds
would,
like it helped to have your family really chime in and hear it from your mom.
yes, yes, my auntie has it. My mom has it. Is a family thing. It's hereditary, I'm guessing, because we all have it, and they are all my cousins. They're younger than me. Even the mama, she'll inbox me. She'll be like, what you take for such and such?" And she is also an inspiration to me because she's in school for a nurse. She is a nurse, so it's like, my family plays a big role in all of it. They really do.
It's great.
I think first I just realized this. I was like, don't worry. For many of us, the idea of taking medication, I call it we go through the stages of grief. That denial part, I feel like a lot of early lupus patients tell themselves, "I'm not taking that." So don't feel like it's just you. We all, some of us do go through that a lot more than you know. So you're not alone in the feeling of like, no, I don't have this. I
And what
don't.
was so interesting to me, because I was so young, the blood work that she would do every 2 weeks, she could keep track. So she knew if I was taking it or not. She knew, okay, this level didn't rise, this, okay, you're not doing this, you're not taking it serious. So, but yeah, it was all interesting. It was very, very a learning experience, a great learning experience.
And my hats go off to you, Chelsea, being so young, being diagnosed so young. I think for us as providers, it's a lesson for really paying attention to kids in high school that might have lupus. Often it gets missed. And so really those school nurses and really thinking about educational programs while kids are in high school that they could have lupus.
Do you see this a lot, Dr. Pem, that, bringing in family members, because you're talking a lot about, targeting younger groups.
Yes.
Do you
Well,
see
I actually worked
involved?
on a project. It was funded by the CDC to train school nurses to recognize lupus earlier because we are seeing it younger in high school. The idea was also to help them along with the student and their physician or provider do a transition plan for when they left high school, how they were going to manage that lupus. But I think Chelsea's is a great example of because if it runs in her family too, taking a look at that hereditary. But we don't know enough research wise, I think, to even know which families might be at risk. Certainly, I think with genetics and the way personalized medicine is going, this might be also a great area for research
Definitely.
for us to really personalize specific persons who might be at risk early and catch them early.
Thank you. I
Definitely.
mean, well, thank you for the work that you're doing, and just shout out to Chelsea, a true
Yes.
survivor. Thank you to you and Evelyn, lupus warriors, killing it and trying to figure it out, and trying to support those other people that are living with lupus and being inspirations that way. So now I'm going to bring in one of our final guests. We're going to meet Bridget Chapital. She left a big research job to blaze her own trail in the field of clinical research. Please welcome Bridget to the stage, also known as Clinical Trials Lady. Welcome to the stage.
Thank you. It's good to be here.
Oh, glad to have you. Now, Bridget is the founder of the Hypothesis Haven Science Club, which is the mission of helping kids better understand science. Bridget says if she can help kids understand, she can help grown-ups too. So now we're going to talk about this. What made you leave your research director job?
Well, so I've always wanted to work in the health field. And I feel like once I graduated from college, I was lucky enough to kind of stumble into the clinical research industry. And that's kind of a common story that you'll hear from a lot of people who work in that industry. And so I kind of call it sort of like my becoming moment, like from, our Forever First Lady's book. It was just kind of one of those things where I've always just kind of worked and, checked the boxes and got this job and that job. And along the way, as I was doing that, I kind of got to a point where on paper, I had a job it was really, on paper, a really great job. It was in research, which, by then I'd fallen in love with the industry. It was the industry I wanted to work in. But, I just felt as though the role that I was in professionally just really kind of wasn't in alignment with my personal goals. But by that time, I had went to graduate school, gotten a public health degree, and I had always wanted to see a reflection of, more of our population and more of our communities of color in the research spaces that I was in. But really, that just wasn't happening for a number of different reasons. And so, it really troubled me. And it was something that it got to a point where I felt as though, I really actually wanted to have a job that was more in line kind of with my personal interest and my personal mission, which is to really, bring awareness of the clinical research industry and the benefits of it to as many people as I can, especially people, who've historically been left out of that conversation for, a number of different reasons.
And what's so special about the thank you for sharing that. And I'm so glad that you came over on this into this field over here with us. So now just share with us what's so special about the Hypothesis Haven Club.
Yeah, well, so basically, Hypothesis Haven Club is like the first and only health leadership program for elementary school children that teaches them not only the basics of clinical research, but also gives them a very early exposure to a lot of different clinical research careers. So one thing I always say is children can't be what they can't see. So, growing up, I never knew, a principal investigator, which is, a doctor, but it's a doctor that actually does research studies. I knew that of doctors, I've heard of nurses, pharmacists, all of that, but I never had that concept that you can do all of these things within the clinical research industry. And so not only are you treating patients that come before you and you're sick, but you're actually creating new medications that haven't even been invented yet, or you're trying to find cures for diseases that don't have cures yet. Because I mean, it's so commonplace for us to kind of, you have a headache, you go to the medicine cabinet, you grab a medicine for that. But somebody had to like invent that just hasn't always been here. And so it just never kind of crossed my mind when I was younger of like, what is that behind the scenes process before medication gets to your drugstore? Like where does it even come from? And so there is a shortage in this industry. And so, when I had children of my own, I would always kind of tell them what I did. And they were like, Mom, you work in a hospital, but you're not a doctor. Like, what is it that you do all day long? And so the idea kind of came to me of, why don't we start younger and really just kind of educate children about clinical trials? And in that same way, this is also an avenue to kind of like sneak, kind of that back door and get their parents kind of exposed to it so that, before you actually need to go into a clinical trial, before the first time you hear about it is when you're sitting in a doctor's office, dealing with some kind of health condition, you're already kind of familiar with it and the concepts of it, how it works. And so that's really kind of the two things that we really try to do is kind of teach kids that, we need you on the back end being part of this industry, but also here's how to advocate for yourself and here's what they're doing and here's how to understand it so that, everybody can just be more comfortable with the process.
It's awesome. I love the idea of early exposure. So when you're talking to kids about this process, can you, break it down for us? How do you describe it to them?
Sure. So one of the things kind of that we touched on in this conversation, I think it was Dr. Pam, was about the concept of informed consent. And so we actually have a number of after school programs, camps, and workshops. And so all of our sessions kind of start out with us really talking about a topic. And one of my big things is taking complicated topics and really breaking them down so they're really easy to understand. And so on the topic of informed consent, we actually had a lesson about how digestion works. So kids, they learned about their stomach, how it works in school. But we were telling them, did you know that at one point people used to think that when you ate food, it just went in your stomach and it burned up like a fire. So nobody knew how it worked. They just knew you ate and, okay, what's happening in there? Well, there was a doctor back in the day who was treating soldiers at war. One of them got shot in the stomach. And basically the long story short is instead of stitching up this person, the doctor kind of kept that hole open and stuck a lot of different things in there to see what happens. Okay, what happens if I stick meat in there? What happens? So we kind of told the kids this story. And we're able to teach them that, nowadays that's not even allowed because first of all, did you ask this person if they wanted you to do that? No, he didn't. And of course, this is, in the 1800s, so a very long time ago. The things he was doing to this patient, they made the patient sicker. They didn't help the patient get well. And also they were very painful. And so the concept of informed consent was not something that they had back then. But nowadays, a doctor would have to come to you and say, actually, first of all, it wouldn't even make it that far, because unless you're actually trying to treat a person, there are rules in place that you can't just do things just because I want to see what happens. There's rules in research that say you have to be trying to actually make somebody better. But even more to that topic is you actually have to ask their permission. And even if the person says yes in the beginning, once you get started, then, if they don't want to do it anymore, they can stop. And so that's kind of a way that we would kind of teach those kind of complicated topics to kids.
Well, I guess one final question just to wrap up. But what is I'm just curious, and in your experience in thinking and teaching about clinical trials, what do you think is the big difference and the reason why more people probably need to learn about clinical trials, much less just, be a part of them? Why are clinical trials really, really important?
I mean, the most important thing is that, these drugs are going to continue to be made. They're going to continue to come out. But we won't know how they're going to impact people, how they're going to impact older people, younger people, men, women. There are so many different ways that make a drug react differently within a person. We won't know that until it comes out in the store. And then when you go buy it thinking it's going to help me feel better, it may not work in you, or it actually may even make you worse because it just was never tested because we didn't show up to be a part of the studies. So it's really a way to try to, advocate for ourselves, to get ourselves a seat at the table. Instead of thinking of it as an experiment, just think of it as you're doing your part. There's protections put in place. There's, information every step of the way. And, we really just have to show up so that we can make sure that when the medicines do come out, that we know that they're going to work for us.
Okay. Well, thank you so much. We are closing out. It's been so helpful hearing from you, Bridget, Chelsea, Evelyn, and Dr. Pam. Mm-hmm. We just want to really thank Biogen for the time to have this great conversation. Tonight we had such an involved conversation about clinical trials, and we are going to go right to Chanel, who's going to share with us her spoken word tonight.
When trust is historically broken, when what's unknown is exactly that, unknown, when you feel like you're making this decision alone, you are not. You are bringing the world with you. My warriors, we are holding them accountable. We are now demanding power, choices, options. We are healing ourselves and healing others in the process. Fighting side by side, we are opening doors, advocating for more, advocating for us. Thank you so much for joining us. Please join us in 2 weeks as we debunk urban myths. We Black people love to tell stories, but we have to make sure that we talk about some of these stories around experimental testing. So at the end of the day, thank you for joining us. Please make sure you follow us on social media and have a wonderful night. Take care.